Everybody, Dr. JP Guidry here. Just want to take a few minutes from my bedroom quarantine here and just talk a little bit about more about what actually is online training, virtual physical therapy. What does it involve, and what kind of are the benefits or the pros to that, even over in-person training, in-person therapy. So obviously, our situation that we're currently living in has kind of driven the need for more online access to things like this, whether it's healthcare, whether it's health and fitness. But I think this is potentially a good thing in the long term. Personally, these are things that have been around even before all of this. And things that I've done more as a side thing before this, but it's slowly becoming more of a need and a necessity right now. And long term, kind of opening my eyes to maybe more of the bigger benefits of doing more of this as opposed to in person versions of this. In my opinion, it can be just as effective as in-person physical therapy, in-person training. With I think even some more benefits to that maybe you can't provide via the in-person variations of this. What are some of the pros of this? So, for me as a coach or as a physical therapist, you know, my passion is being able to serve others, whether it's improving their health, getting them out of pain, getting them moving better, helping them get back to their goals, whether that's sports specific, functional, whatever that may be, losing weight, all these things that you know I wake up every day and look forward to doing with my clients. The reality is in person, I'm very limited to a geographical area, and I'm very limited to those I can work with inside my schedule. Um, Having the ability to go online through telehealth, physical therapy, through online training programs, it allows me to serve many more people outside of my geographical location and outside of the schedule that I can work. And so it just allows me to help more people again, which is my passion, what I love to do. From the patient or the client standpoint, I think one of the biggest things it does, and things that we can kind of not do a great job from the in-person standpoint, is it helps build self-efficacy. And what self-efficacy is really just each person's judgment on their ability to succeed or to reach a person goal. So reach a specific goal. So their ability to kind of do this on their own, and online training, telehealth, all these things kind of puts the client or the patient in the position to almost have to do this a little more. It becomes less of the PT or the coach or the trainer doing all the work and you just kind of following directions, to more of the trainer, the PT, the coach being a guide, and kind of being there by your side, being there to motivate you, being there to educate, being there to hold you accountable, but also to allow you to do these things on your own and to learn and to grow and to build these habits on your own. Because the reality is any of this stuff that we do, whether this is a 6-week program, a 12-week program, or 30 days, um, the goal is still to instill these things long term. Health and wellness doesn't just stop after 6 weeks or 12 weeks or whatever. So, I think the online program, the virtual, telehealth world of this, kind of forces us in as coaches, as PTs, to now have to change our approach from kind of being the guru, being the expert necessarily up here on top, and being more side by side with our clients and guiding them through, but allowing them to do more on their own, because in the end that's what's going to have to happen to build these lifetime changes. From a just a scheduling standpoint, obviously it allows clients and patients to do the workouts on their own schedule. That can be built around access to minimal equipment at home, which obviously right now is more of a necessity. And then when gyms open back up and things like that, allows us to build programs and workouts and rehab programs around, gym access as well. Allows you to work out on your schedule. So what's convenient for you. So one of the big things about building health habits is reducing the barriers. And so kind of forcing someone to have to come into a clinic or a facility at, an hour that maybe doesn't work best for them, or maybe they have to take time off from work, or they've got to go and work earlier or later to make it work. Now they can fit it in on their schedule. They can fit it on their time frame, and it may be even doing a simple, 15-minute, telehealth conference or video conference, on your lunch break, instead of having to leave work, take an hour, hour and a half drive time plus treatment time, go to a clinic, go to a gym, things like that. Those things are still available, obviously, out there, and so there will still be a need for those things, or even a want for those things. Some people still want that in-person connection, and that can always be worked into, more of a hybrid type program. But it takes the need of that out of the equation. It makes it easier in these programs for us as coaches to be more consistent with our accountability, with our guidance, with our motivation. Allows us to make modifications on the fly. All of my programs, whether it's rehab, whether it's fitness, wellness, sports performance, there's messaging access to me, there's email access, there's, weekly email check-ins, and then we have different degrees of either over the phone or video conferences, whether that's weekly, bi-weekly, monthly, whatever each person needs to dig a little deeper, reassess those type of things, and progress the programs, as needed as you go along. It allows us to kind of provide on the fly nutritional guidance. So instead of just kind of handing you a program and say, do this for the next month, we can do day-to-day, week-to-week check-ins and touch and base. And I like to start everybody with a 2 to 3 day food journal, so we know where you're starting at, and we can kind of go from there to build from there and look where we need to make changes. And again, all this is about building habits more so than getting on this perfect diet or this perfect program, because the reality is that's going to change. Our goals may change, but the habits that drive these things and that drive success in these things will generally be the same. And so in order to make long-term success, building habits is an important part of that. It'll, from my standpoint, it allows me now to expand what I can offer, build some more online educational programs, membership programs. I've got something in the work that I'm kind of tentatively calling Lifelong Athlete University, which is going to be more of a membership type program to access to educational material, courses, programs, videos, things like that. And so, and then it allows me to expand more offerings that fit each person's needs, whether that's schedule, whether that's financial, whether that's, changing goals. And again, this can be made to fit fitness and wellness. It could be made to fit rehab. These things from, you needing to come to PT 3 times a week for 6 weeks, or needing to train in person 2 to 3 times a week on a regular basis. It now allows us to kind of expand and change those things where we can still have that in-person option if needed, but it makes it more convenient for you, the patient or the client, to have access to these things and be able to stay consistent. Because for most people, especially working people, parents, having to take an hour plus out of your day to go to PT or to train becomes a lot harder. And so, any way we can decrease those barriers to entry and to consistency with this is a great thing. So, to kind of close this out, obviously the current times we're living under, force us into this more virtual world, acutely short term. But for me, I think this is a great opportunity to expand health and fitness to the masses, to provide more of a benefit, and a more of a convenience from both the coaching side as well and the PT side, as well as the patient and the client side. Because in the end, myself and anybody else who gets in this field, we really just want to help people. And, I think this will provide us more opportunities to do so and to do so more successfully. For those of you that do know, I'm currently under, you know, a 7-day bedroom quarantine. I did have fever for a day. I don't have fever anymore. I personally think it was more of a sinus infection, but as of now, I can't get tested. So I have to kind of treat this as the worst case scenario, which is fine. I feel fine. I'm more trying to keep my sanity stuck in my bedroom, in this bedroom, than anything. But so just a little update on that, but I'm doing fine. So there's a lot more people out there doing worse than me. So hopefully I can get tested soon and get out of this situation. But um, for those of you that want any more information on telehealth, telephysical therapy, from that standpoint, I'm licensed in Texas, Louisiana, and Mississippi to be able to deliver that to those states. And then any of the fitness, wellness, sports performance online program, virtual programming that I do, all over the world, essentially, with that standpoint. Feel free to comment below the video. Feel free to drop me a message or email me at johnpaul, JOHNPAUL, at guidrypt.com. You can visit my website. So from the fitness, wellness, sports performance side, guidrygolfandsport.com. And then from the physical therapy telehealth side, which is it's fairly new for me. I did have an outpatient clinic for about 7 years, and I've been out of that for a couple of years. And so I'm kind of entering back in the virtual world only. But you can find some more information on that at www.guidrypt.com. So hope everybody's staying healthy out there. Hope everybody's staying on top of their mental and physical well-being. It's even more important and wonder what we're going through at this time to stay on top of that, to focus on the positives, to control what we can control. So everybody stay healthy out there. Thanks for watching.